Hi, welcome to Easy Learning of Anatomy. Now we'll discuss about anatomical terms. First, we'll see basic anatomical terms. What are the basic anatomical terms? First one is anterior. What do you mean by anterior? Front aspect. The structures which is located in front, that is called anterior structures. Then posterior, that is back aspect. The structures which is located backside, these structures are called posterior structures. Then medial. If we draw the imaginary line in the midline of the body is divided into right and left half. Imaginary midline, if we draw, the body is divided into right and left half. The structures that is very close to the midline, that is called a medial structure. The structures away from the midline, that is called lateral structures. Then next one is superior. The structures very close to the head, that is called superior, that is towards the head end. Inferior. The structures close to the foot end, that is called inferior. These are the basic anatomical terms. Anterior, ventral or front aspect. Posterior, dorsal or back aspect. Medial, towards the midline of the body. Lateral, away from the midline of the body. Superior, towards the head end. Inferior, towards the foot end. Then next we have to discuss about special terms for limbs. What are the special terms we'll use under the upper limbs and lower limb? The first one is proximal. So what do you mean by proximal? The structures nearer to the trunk. Trunk means body. See, what do you mean by distal? The structures away from the trunk. For example, if you compare the shoulder joint and elbow joint, shoulder joint is proximal structure. Elbow joint is distal structure. If you compare the elbow joint and wrist joint, elbow joint is the proximal one and wrist joint is the distal one. Then next special terms for limbs. Radial, ulnar. If you see the forearm, we have two bones in the forearm, radius and ulna. Radius is the lateral bone. Ulna is the medial bone. So radial means outer border of upper limb. Ulnar means inner border of upper limb. The next thing is tibial and fibular. Tibia and fibula are the bones of lower leg. If you see the tibia and fibula, tibia is the medial bone of the foreleg, fibula is the lateral bone of the foreleg. So tibial means inner border of lower limb, fibular means outer border of lower limb. The next term, that is flexor surface. Flexor surface. In the upper limb, the flexor surface present in anterior aspect. That muscles that helps for flexion. In the lower limb, the flexor surface that is present in posterior aspect. Then, if we see the extensor surface, just opposite to flexor surface. If we see the posterior surface of upper limb, that consists of extensor surface, that muscles used for doing extension. If we see the lower limb, the anterior surface, that is the extensor surface. Once again, flexor surface means anterior surface in upper limb, posterior surface in lower limb. Extensor surface means posterior surface in upper limb anterior surface in lower limb. Next, we have to go for the hand. If you see the hand, what do you mean by dorsum? Dorsum means posterior aspect. Dorsum means what? Posterior aspect. For example, the radial nerve passes dorsally. That means the radial nerves passing in the posterior aspect of the hand. Then palmar, that means anterior aspect of the hand. Front aspect of the hand, that is called palmar. For example, median nerve that reach the palm of the hand, that means that reach the front aspect of the hand. Then in the foot, if you see the foot, superior surface of the foot, that is called dorsum, dorsum of the foot. Inferior surface of the foot, that is called plantar, that is sole of the foot is called plantar aspect. These are the special terms used for limbs, that is proximal, distal, radial, ulnar, tibial, fibular, flexor surface, extensor surface. Then we are going to discuss about the special terms used for hollow organs. What do you mean by hollow organs? Any organs inside, if there is a presence of space, the type of organs are called hollow organs. For example, heart is a hollow organ. Inside there is a presence of blood. Then one more example, urinary bladder, uterus, all these are hollow organs. If we see the hollow organs, we have two aspects. So interior or inner side, interior or inner side, then exterior or outer side. So what are the special terms used for hollow organs? Interior or inner side, exterior or outer side. Then the terms used for solid organs. So the special terms used for solid organs, that is superficial and deep. What are the terms used for solid organs? Superficial and deep. Superficial means towards the surface. Deep means inner to the surface. That is the terms used for solid organs. So these are the anatomical terms. Under that we completed basic anatomical terms, special terms for limbs, then terms used for hollow organs, terms used for solid organs. If this content is useful, you can subscribe the channel. Thank you.